Hey guys, my name's Alexis. I'm doing a video on labor and delivery. I'm going to go over some of the questions you should ask, kind of what to expect, and then show you a couple different ways that a baby can be born. I'll show you a normal way and then a couple ways that are a little bit different from your normal birth. So if you get dispatched for an imminent delivery, you're going to kind of want to be running through your head, what to expect, what it's going to look like when you get there, kind of have a game plan going with your partner on the way there, just so you're not kind of shocked by what you walk into. You could be dispatched for an imminent delivery and she could be crowning, she could be in like the final stages of labor, or she could be having contractions 5 minutes apart and not even be close to having the baby, but she's a first time mom and she got worried. Totally okay. It happens. Labor is scary. A lot of people don't know what to expect, and we're here to support women in every way possible. So, whenever you pull up to the scene, you're going to want to find mom, obviously. She could be in a bathtub, she may be in bed, she may be walking the stairs, she may be standing outside waiting for you. All of these are just kind of different positions that may help her feel more comfortable during her labor. So whenever you find mom, you're going to obviously want to introduce yourself, tell her that you're here to help, and you're going to start asking a couple questions. So some of the really important questions you want to ask is, how many weeks pregnant is she? If she is over 38 weeks, it's considered a full-term delivery. Prior to that, it is preterm. If we're closer to like the 24 to 26 week range, this is going to be a big concern. You're definitely going to want to call in a second crew because that baby is going to be premature and need a lot of support as it comes out of the womb. So it's an important question to ask. Is it her first pregnancy? This is an important question also to go with how many deliveries has she had. So if mom has only had her first kid, labor can take longer. You may actually be able to make it to the hospital depending on the distance. If this is her third or fourth, fifth, sixth kid, labor is going to move a whole lot faster and you need to get ready now. There is no time to wait. That baby is coming. The body knows what to do. It's done this before. It's ready. You're going to want to ask her if she's having contractions. So contractions, you're going to want to know how far apart they are, how long they last, and when did they start. So the start time is important to see how long she's been in labor for. How far apart they are, you're going to gauge that from the start of one contraction to the next. Most moms will have a timer going on their phone. Don't ask dad. He's probably not going to know. So ask mom how far apart they are. If she has a timer, you can look at it. It's a great resource. Or she may have a stopwatch going or something else of the sorts. You're going to want to ask if her water is broken. So the water typically, in most cases, will break closer to the actual delivery of the baby. Sometimes it can break hours before or days. It's not uncommon, but typically occurs when she is close to 2 centimeters dilated and delivery is kind of becoming closer. You're going to want to ask her how much came out. Was it a little bit? Was it a lot? And what color was it? If it was clear, great. That's awesome. That's what we want. If it was brown or green or something of that nature, that means that baby has had a bowel movement in the womb. And this becomes a huge concern for infection for both mom and the baby because the baby's going to aspirate that fluid more than likely as it's being delivered. And then for mom, now she has stool in her uterus, and obviously that's a big cause of infection. You're going to want to ask her if she has the urge to push or have a bowel movement. So as the body progresses into labor, even if mom isn't sure where she's at in labor, that's a pretty good telltale sign that labor is getting close to the end and we're about to deliver this baby, because the body naturally starts to feel like she needs to have a bowel movement or push as the baby's head progresses into the vaginal canal. You're going to want to ask her if she feels anything between her legs. Does she feel the baby's head? Does she feel like there's something down there, or is she just feeling a lot of pressure? This is also a good time to ask mom if you could look down there. If you see the baby's crowning, you know that delivery is right around the corner, so get ready. You're going to want to ask her how many births she's had, but we kind of already went over that. A big one you're going to want to know is if she's had any complications in previous pregnancies or deliveries. If she's had previous C-sections, this puts her at a higher risk for needing another C-section. It can also put her at risk for uterine rupture during labor and delivery if she's doing it at home, because that uterus has now been cut open and put back together at least once or a couple times, and it's more likely to rupture during labor and delivery. Does she have preeclampsia? This is high blood pressure during pregnancy. Did she hemorrhage with her last pregnancy and delivery? That's a big question you're going to want to ask, because if she's had a previous hemorrhage, chances are it's going to happen again. It's not a guarantee, but it is definitely something to look out for. And then, how was her last baby born? Was it breech? Was it a normal position? How did it come out? Did it get stuck? Were there any issues? Has she had prenatal care? This is just important to let us know the health of mom and baby and how they're both doing. Things that could indicate some additional red flags that you're also going to want to look out for is she bleeding. A little bit of blood is expected during delivery, but not a whole lot. There shouldn't be a whole lot of blood at all. The blood typically comes from the tearing of the perineum. If that happens during delivery, shouldn't be a whole lot. If she's bleeding and it's bright red and there's a lot of it, we have concerns for things like placental detachment, uterine rupture, or any other kind of complication that can cause bleeding during labor and delivery. Does she have pain outside of the contractions? Is there something else going on? Did she have an injury that kind of provoked the labor and we're distracted by the delivery of the baby and we're ignoring that injury? Is mom having any signs of shock so far in this process? Is she pale, sweaty, hypotensive, diaphoretic, just not looking well? You look at her and you're like, she doesn't look good. If delivery is imminent, obviously you get prepared to deliver in the house. Have dad get some towels, some blankets, maybe the hospital bag if he hasn't gotten it already, to kind of give him something to do to help the situation so he's not just standing there freaking out while mom's freaking out, and then it's like an endless cycle of freak out. If not imminent, you will want to transport her in the left lateral recumbent position. This takes the weight off of that artery in the tummy so that mom and baby still get good blood flow, and it's going to be a little bit more comfortable for her. Maybe not the greatest. It is a stretcher. No one loves laying on those things. So one of the things that's important to notice and take note of during the delivery process is if mom feels the urge to push, encourage her to push. Do not tell mom not to push. That's going to be more painful for her. And honestly, it's not going to work anyway, because there's something called the fetal ejection reflex. That's where the body naturally pushes the baby out of the uterus, even if mom isn't pushing. So that baby's going to come out whether mom pushes or not. Yes, mom aids in the process if she pushes when she feels the need to urge, but it'll still happen even if she doesn't push. And then after the delivery, you're going to want to make sure to monitor blood loss. If you're noticing some blood loss, totally normal, to be expected. The placenta did just detach from the uterus. That's going to cause bleeding. If you're noticing a lot of bleeding, and mom's kind of starting to show signs of shock or like just not acting right, you can do two different things. You can massage the fundus, which is the belly, because the uterus is high up in the belly from where that baby was. Massage it in a circular motion, and it should help that uterus contract and clamp down. If that doesn't work, you can encourage mom to breastfeed. This works because it stimulates the production of natural oxytocin, which helps aid in uterine kind of contraction and cramping and get it back to where it needs to be. If you're still noticing that there's a lot of bleeding and mom starts to go into shock, that's definitely going to be something that you update the hospital of with your report on the way in. So as far as delivery goes, got this cute little baby doll here. And I don't have the fancy mannequin that the school has, so I have a blanket. And we're going to make what do. So during delivery, mom's going to be pushing, baby's going to be coming out. As baby works its way out of the uterus, it's going to come out kind of sideways like this. Oh, fell in the way. So you'll notice that the baby's face comes out, they're sideways. As mom continues to push, this shoulder is going to come out. You're going to want to grab under the baby's head just to support the head as it comes out. And you're going to want to add just a little bit of traction to help get that other shoulder out. As that pops out, you're going to pull the baby, you're going to guide the baby out of the vaginal canal and then pick it up. Make sure you always support the head in a newborn because they cannot do so themselves. Very important to do that. So that's kind of what delivery should look like. And I'll show you a couple different alternatives to that. Baby can also come out what's called sunny side up. So that's when the baby's head is at the bottom of the vagina instead of to the side or to the top. This will be more painful for mom because this isn't how the baby's supposed to come out, so it's really uncomfy for the body. But you're just kind of gonna do the same thing. As baby comes out and starts to rotate, you're gonna apply gentle traction to get those shoulders out, guide baby up and out, and then support their head. Then you're gonna wanna wrap them in a towel, make sure they're breathing, do an immediate APGAR. Regardless of what position they come out in, you're going to do an immediate APGAR and then do 1 to 5 minutes later. Just to make sure that baby's doing okay and everything's looking good. Then I've got 2 more to discuss. So another way baby can come out is breech. Most of the time, if mom is under prenatal care, she should know if the baby is breech or not, because they'll do an ultrasound in the 3rd trimester just to check that baby's in the right position. Breech birth is just a variation of normal birth. Takes a little bit longer, a little bit more uncomfortable for mom. Baby tends to need a little bit extra suctioning because as they're coming out of that vagina with their feet first instead of their head, that fluid's not getting pushed out of their lungs. So they are at a little bit higher risk for respiratory issues post-delivery, but they will still come out. So baby's gonna come out feet first. You'll see either 1 leg or 2 legs. And as baby works their way out, you'll just support them as they come out. It may take a little bit longer to deliver the head just because they kind of came out backwards and the body's like, hey, this isn't what I was expecting, but we'll make do. Same thing as baby comes out, guide them out and up. And then the last one is just a complication of delivery. It's not necessarily a birthing position, but it does happen, and it's good to be aware of what it is. Because it does indicate a medical emergency, you need to call the hospital and make sure that they're aware, and possibly call for a backup ambulance depending on how comfortable you're feeling. So this is something called shoulder dystocia. So this is where the baby's trying to come out of the vaginal canal and the baby has crowned, everything's looking good. You can notice with shoulder dystocia specifically that whenever mom pushes, the baby will come out, but it'll go right back in. There won't be any progress made in the descension of the baby. They don't teach us how to cover this in the field unless maybe like your specific department does, but overall it's not something we get a huge education on because it is a medical emergency. There's a lot that can happen while trying to fix the process of a shoulder dystocia. Basically, that just means that their shoulder is stuck on the pelvic brim and the baby's not able to come out. So again, mom will push, baby will come out a little bit, and baby will go right back in. Biggest thing you can do for this is a little bit of diesel therapy. You're going to want to hit that gas, get them to the hospital as soon as possible, because complications from this can be things like hypoxic brain injuries or cerebral palsy. As always, when delivering the baby, one thing you're going to want to look for is cord around the neck. So if baby's coming out and you notice a cord around that neck, just gently try and get your finger under and loop it over the baby's head, untie them. Doesn't take very long. Should be a fairly easy procedure. If you're trying to pull and it's not coming, don't tug on it. Wait until baby's delivered a little bit more and then just go ahead and unwrap that cord. It's very common, occurs in a whole lot of deliveries. They just don't talk about it very much. Thank you. Hope you enjoyed my video and my baby, and I appreciate your time.